Jefferson Health, one of Philadelphia's biggest health networks, is laying off hundreds of employees, citing major financial issues.
So on the news yesterday, Jefferson Hospital came out with an announcement. The whole healthcare system, they have about 5 or 6 hospitals, that they are laying off between 600 and 700 healthcare workers. There is no specific detail at this time as to what kind of workers those are. They say it makes up about 1% of the workforce. But here is a fun statistic that I actually, of course, I do my research. Do you know the CEO, Dr. Joseph Cacchione, made his salary was $5.38 million as of 2023. That was his yearly salary. I'm not saying this gentleman doesn't work hard, okay? But I'm looking at what I make and what I know a lot of my friends make that work for Jefferson and similar healthcare fields. And we're the ones doing the care and bringing in the revenue and charging for services to healthcare providers. Those CEOs don't have the blood, sweat, and tears that we are seeing every day, and we're working our asses off, and nothing that we make is reflecting cost of living increases, okay? The fact that most of my friends can't even pay rent or buy a house, okay? So what's wrong with this picture? They have reported, according to this article, a $1.95 million loss as of June 30th. That was the end of their fiscal year of 2025. And the CEO's salary is $5.38 million as of 2023. What's happening? What's going on here? Where's the disconnect? I mean, we all know healthcare is for profit, and that's where the biggest problem is. I've been seeing, the care go downhill.
Jefferson literally saved my mom's life 21 years ago. They will forever have my respect. I'm sorry to hear this. The doctors, the nurses, and staff at Jefferson saved her life. They deserve the respect, not the company. I was a Jefferson nurse. They treat all their staff like dogs. Awful organization to work for. Temple is no better. I thought healthcare was one of those only sectors doing well. This is scary stuff. Just lost my boss today. She was one of the best I ever had. Can't believe how they did this. I'm sorry to hear this. It really sucks when great people get caught up in this, and I'm sure that the work will suffer as a result. Yes, it really does. We had no clue it was going to happen, until they sent out a simple email. I am beyond stressed, unsure if more will be affected, and we were just bought by Jefferson. A lot of their staff still have no idea how to run our systems. I kid you not, I was just about to make a vehicle purchase after many years of driving my old 2001 Honda. I got a cashier's check for a deposit, and after getting the email regarding layoffs today, I am stunned and about to go get a refund on my cashier's check. Prayers for all of those who lost their jobs today. The way they are going about it is an absolute bullcrap too, disrespectful to people who loved working there. I've been told the budget is too tight to even afford the security escorts. Look at the C-suite pay at Jefferson. This is where the imbalance is. One of their C-suite is flown in from his home, and another has 24/7 personal driver. Jefferson, pay your staff instead of the fat cats. That imbalance between C-suite and the staff that works with patients is a problem across the board, regardless of the industry. I will say that it seems to be much larger disparity within healthcare. So after reading some of those comments, we saw that the experience for workers there wasn't really that great. Now, it's no surprise that now the hospital is being sued for violating federal rules. A lawsuit filed Tuesday in Philadelphia accused Jefferson Health of violating federal labor rules when it laid off 1% of its 65,000 employees in October, and this month without providing a 60-day notice. The perpetrated class action lawsuit said the proposed lead plaintiff, Kiara Brees, lost her job as a medical assistant on November 12th with no notice and has not received the severance pay she was promised. And this is not just happening in a single hospital system, it's happening in many different companies across the state and across the country. I mean, just 45 minutes away at the Pottstown hospital, they're laying off 131 nurses and closing the entire ICU unit.
We're losing our ICU. We're losing half of our hospital. We're not just losing our jobs, but our patients, our town is losing what they need.
In Montgomery County, we are now hearing from staff members about recently announced department closures and layoffs at Pottstown Hospital.
A representative for Tower Health confirms to CBS News 131 positions will be eliminated within 60 days as the hospital closes the intensive care unit and cancer and endoscopy centers.
My coworkers and bosses were not only caring for their patients, but for me as well.
Maria Gutierrez is a cancer center nurse who says she worked caring for others while battling her own cancer.
Because that's the Pottstown Hospital way. We care for each other and the members of this community that we're all a part of.
Tower Health said services will be offered at its other locations, and in a statement wrote in part, these difficult decisions were not made lightly. They were made out of necessity to ensure that we can chart our own pathway forward and continue serving our communities. Hospital workers call it a sad moment.
That building has seen births, deaths, recoveries, heartbreaks, and miracles.
Johnny Corson says he's filed a complaint with the Attorney General's office while worried about hospital workers.
How can you go tell the nurses in the middle of the day that they won't have a job in 60 days? And then they got to go out and then they got to talk to those cancer patients. They got to treat them cancer patients. They got to keep a smile on their face. They got to show compassion, and they can't let their emotions come out.
Tower Health confirmed it's laying off 350 employees across its network and 131 in Pottstown. In an internal email sent to staffers, Tower CEO said almost all of the affected services will continue being offered at other sites within our network. But hospital staffers and community leaders worry that the cuts are the precursor to something bigger.
When you cut the services that they have for cancer, the ICU, the next step is closing.
She says, I'm a nurse and my hospital is shutting down the ICU and endoscopy suite, cancer center and med surg floor as of January 16, 2026. They want the ICU nurses to train the ER nurses to respond to the RRTs, codes, stroke alerts, etc. This was the ICU nurses' responsibility. We aren't allowed to transfer to other hospitals in the network. We aren't being offered replacement positions. They also want to provide us with severance because they gave us 60 days notice. We are wondering, is it because we are a unionized hospital and they don't want us to go influencing other hospitals? There has been a large public outcry, but the C-suite says the decision is final. Many of us have started looking at other options. What options do we have to keep the ICU open? The community is already underserved and will be devastating for them. We have seen mass nursing layoffs in 2025, and I'm sure we'll continue to see them in 2026. And now a lot of the healthcare workers are worried because healthcare used to be a dependable and safe option. The healthcare industry isn't the safe bet people think it is. It is facing a reckoning soon. Wow, and I thought that nursing was a recession-proof job. Yeah, sorry, been a nurse since 2012 and I'm being tossed out like trash. I'm an OT and I was kicked to the curb in July after 21 years at the same place. Nobody is safe, my entire department was eliminated. For-profit healthcare does not prioritize people. So many hospitals have closed in Chester, Montgomery and Delaware counties. Where are all the people needing care going now? The state gave Tower Health a multi-million-dollar bailout last year. How could this happen? The Philadelphia area has been hit really hard with hospital closures. Earlier this year, both Chester Medical Center and Taylor Hospital closed. Tower Health is notoriously bad. They bought Chestnut Hill Hospital in 2017 and a handful of other hospitals in the area. Ended up closing some of those and then almost ran Chestnut Hill Hospital into the ground. This is just one city in America. The entire healthcare industry is on the verge of imploding, and in some areas of the nation, there won't be any hospitals within the 2-hour drive. The for-profit hospital network system does not work and never will.